So she literally just looked at me and said, Angela, you have stage 2 breast cancer. Sorry.
It's okay.
I mean, you think about your mortality, you think about chemo, you think about death, you think about how you're shocked. It stopped me. It stopped my breath. It stopped me from seeing clearly for a second.
I just say it like it's spelled, as you well know.
Yes.
And the reason is simply that it's already such an unwanted diagnosis. Going through a breast cancer journey, it may not even be cancer, it can be a gene mutation or a benign thing that's still and life-changing or life-altering.
I think that sort of overwhelms you. It can swallow you up a little bit, I think. Because I couldn't believe it. I was really shocked. Even though it was a physical, like you could see this little lump on my chest. I never in a million years, 3 months I saw the lump. I never in a million years thought it was breast cancer. It's just, and so the word cancer, I think, is what gets you, or got me.
There's this moment between the ultrasound going down and when I know I'm going to say, I'm worried about what I'm seeing. But in that moment, I'm the only person in the whole entire world that knows that you have cancer.
Yeah, she did a biopsy, and the biopsy hurt. It's this gun that they put in your breast, and they kind of get a tissue sample.
But what holds me in that moment, kind of suspended for a second, is knowing that her entire world is going to get rocked and altered.
Then they left the room, and I was laying there. And then she came back a couple minutes later, and did not waste a single minute. And this is how I started to react a little bit, because after she told me, so she literally just looked at me and said, Angela, you have stage 2 breast cancer.
First thought was losing our firstborn child was unbearable. And I knew that she has to overcome this any way she can.
I stopped to talk to Dr. Funk, and that's when that's about the first and only time I cried. And it was basically because I knew what my child was going to have to go through. And that was very upsetting to me. But in the long run, when I went through with her how she chose her treatment, I had a totally different philosophy.
I remember her telling me I wasn't going to die from this. She will die someday, but you're not going to die from this.
Oh, Angela, Palmieri, 11/11/72.
Once I got past the fear and, I grounded in the meditation and grounded on my tools that I was using, I was going to use it.
I don't have the science for it, but I believe your immune system is stronger when you are expecting to heal, expecting to succeed, and expecting to do well and feel well.
So in sharing my phases of recovery and what I learned along the way, I'm really hoping to inspire people to kind of transcend any adversity they face. There's a way you can use it, accept it, and come through it better than before.
I had an appointment with Dr. Funk on that Thursday that was going to be the meeting. It's the meeting where you get to she has got the test back and does everything. I debated whether or not to take anyone with me so I could understand what I was dealing with before I told people, because more information was better, I thought. But then I also didn't want to have to explain it, especially to my mother, who's a registered nurse, my family. after my family had known, that was, my mom helped me with that. I didn't have to really tell them and get into the whole story. I had first told my friend Elizabeth. She was the one she was the lucky one. I got the news first. We went to dinner and she was a little surprised, and I wasn't sure after her how far I was going to go. Then I had shared it with my friend Denisha, who's one of the other people in my life, and she suggested I get everyone together and tell everyone at one time.
I wanted to make sure she felt loved and supported because that's what she does for all of her friends. We invited a bunch of girlfriends over. We had Italian food. We had wine. I had made everybody t-shirts, and Angela was able to tell everybody at once.
For the first time that night, I said it once. I shared with these 10 women. And I got just like this, you see me now, why they had all come together. You know, people thought I was moving out of the country. People thought a bunch of different things that were different. I was pregnant, was one, it's not it. It was one of the best things I ever did.
So at my most vulnerable time, which was sharing all of this news with my friends and my family, it forced me to set the tone for everything that was going to come at me and approach anything with a sense of grace and composure.
So I don't know. I know I can do it. I know I'll get through it. I just, I'm just afraid for a second.
And as a patient, you really just want to focus on being the strongest patient to show up possible, internally, mentally, spiritually, all of it. Your thoughts can be your worst enemy, but they can also be your best friend.
You can argue that mindset colors the entire road ahead. Because, well, without your mind, without your thoughts about a situation, there's no situation. If you believe that you knew all your life that cancer was going to get you, and then of course now it's here, and you're not even going to fight because what's the point? Because mom died young and my cousin just died a month ago, and so if your mind goes into some sort of unraveled, I already lost this battle place.
If someone can get their mind right, get their body right, meaning working out, eating right, and get their mind around what's going on, that's probably the most important thing. Being present is probably the key, because if you're present, you don't have time to worry about the future.
Taking care of myself and my spiritual mind. That became a regular, anyone that knows me knows the affiliations I have with that place, this meditation, yoga. So it became more regular in my life.
Not everybody can expect it to see rainbows and sunshine all day long when they're going through a cancer journey. There are dark days, there are disappointing days, there are acceptances of a new reality, be it a temporarily bald head or a nipple without sensation for the rest of her life. There are things that you grieve.
I'm a little unbalanced today, is what I can say, and I'm gonna go try. And now this is the time where meditation's gonna help me probably, and reading a little bit tonight, and just recalibrating.
What I saw in you was definitely an attitude of victory. You'd already claimed the victory. You walked in, okay, what do we have to do? I'm focused now. I couldn't hear you before. I'm focused now. Pad and paper, you were ready to get your marching orders.
For me, I became grounded when I focused my thinking and my thoughts to just getting better and being healthy.
I've taken so much pride of how I take care of myself. I'm a little nervous about compromising compromising my insides with chemotherapy.
Just, how to process all the information that was headed my way without my thoughts getting away from me and causing me more struggle and suffering was what I was facing.
So some people really need to know every single option and thought and plan and what if and pathway. Other people are the extreme opposite. Just tell me what to do, doc.
This does not cause uterine hyperplasia at all.
Okay. Bonus.
Yeah. It doesn't cause
Okay.
blood clotting like rituximab does.
The chemo was poison, in theory, in my mind. I was a healthy person. Like, other than alcohol, I tried to eat pretty healthy, and the idea of flooding my veins full of a poisonous medicine, quote unquote, was just mind-boggling to me. I researched them up and down in terms of what was in them, what side effects there were.
Oncotech's going to help us with that score when you get that score back in terms of trying to risk stratify you.
Right.
Because the real question is, do you need chemo or not?
When we boil this meeting down, yes.
That's what this is really about. And I think the
I
Oncotech...
call it medicine, by the way.
That's fine. There's lots of other nasty words for it.
This is not going to be like a sledgehammer.
Okay.
It's going to be okay.
Okay. At the end of the day, you can only have faith and trust what the educated and empowered you decides to do. In that, I regained confidence in my own voice.
I'm going to go through a period where I probably will say goodbye to her, even though she was fantastic, but she's different than the Angela I know now and speaks now. She's more at peace, for sure. She's more self-confident, ironically. I'm grateful because I could be in a much different phase than I am. Confident I'm going to get through it. I pray for those around me not to worry.
This is not her debut on film, by the way.
Baby steps, spoon feeding. And I have to let her continue to be fearful, but hopefully then there's less and less to fear as she takes that one step at a time.
In 2 weeks. Just fucking ludicrous. But I only have 4 times to go through it. I only have... The first one will be a jolt. Number 4 will suck. And if I get to keep this head of thin, shedding hair in the middle, I will.
So I needed a new level of awareness. And so with meditation and stillness, I was able to enrich my body and nurture my body. And therefore it affected kind of my soul, and who I am today is different because of it.
It's scary. The side effects you can read. I found my mother was sending me lawsuits on losing your hair permanently from tax to tear. The vomiting, all the things you hear about when you think of chemotherapy, the movies you think about, Philadelphia, the images of chemotherapy in your head start to elevate and start to show themselves, and it can drive you literally crazy. And then I started to reframe my language. It no longer was going to be considered poison. In my mind, it was medicine. I no longer was going to call it chemotherapy. I was going to call it treatment. And I was going to be the strongest person to look at chemotherapy and be ready for chemotherapy possible.
I remember telling her, because Angela is super, pure eater, takes care of her body all of the time. And I said, well, why don't we just treat this like a cleanse? And so that's what I tried to refer to it as much as possible, is how's the cleanse going?
It's the morning. It's the first day of treatment. I had to sneak away for a minute. I'm in the bathroom of the doctor's office. I felt like I just needed to take a minute and record a message prior to getting that medicine in my system.
All right, Peter's prepping the cold cap right now for me to put on. Measuring the temperature. What does it have to be? Under how?
30, around about 32, 34, 32 Celsius. Minus.
Minus. Freezing.
Yeah.
I don't know what I'm doing with it yet. There's Kat, my nurse. Say hi. Videoing myself. See? This is Peter. He's my hair angel. This is our pre-look of the cold cap, prepping for my cold cap.
I'll cover it though, just to be extra secure.
Cool's always been a little odd with me.
You're in video.
Excuse me.
Oh, I don't want to be saying that.
No, you don't. You can edit it out. Thank you, Sina. So we do this before I get my medicine. And he's getting ready to put the cold cap on my head. That's my angel, Peter. Say hi, Peter.
Hi, Peter. Let's get those sides right.
Hey, will you really
Day one is you still feel like yourself. I still feel like myself. I was nervous, a little scared, just only about what they're actually putting in my body. The medicine was the shortest part. I think the longest part was trying to keep my locks, and but I don't mind it. I have a fantastic angel in my life named Peter Ishkan, who's been helping me go through the process of trying to maintain the hair on my head. I'm on day 5 of after getting treatment, number 1. Jet lag be the best way to describe how I feel all day. The exercise part really does help. Ironically, you don't want to, but once you do, you feel like 10 times better. To say today's the first day I felt like myself in a week. So this is what it looks like 1 week in after chemo treatment number 1. So not bad. Not bad.
I had to learn to listen to my body and just nurture it and let that be my guide of like how I was going to handle the next day and the day after that and the day after that, because every day was a new day the minute I got my first treatment.
Today was seemingly okay. We had a glitch in the beginning, a little hurdle with my IV setup. So right now I'm dealing with some ice pack issues on my veins. So to try and help them not become as black and blue, we needed 4 pokes to kind of get that needle situated. But again, I have to say the ability to, breathe and calm yourself down during the tenseness that surrounds you when things aren't going right is the most difficult thing to do, but also the most helpful. I was blessed by an angel today. Yes, I was. Spent time with my nephew today, which was got me choked up. I can't even believe how much I appreciated it.
The intention I had with my thoughts and how those thoughts then related to my body were key to me dealing with every unpredictable day during my chemo treatment. Hi there, it's Monday, June 20th, I think. I am on my way, I just left work. I'm on my way to acupuncture. It seems that this could possibly be helping my energy level. I do feel a difference with the medicine the second time. I just feel it's more prominent. I think I'm just tender everywhere. and hopefully the acupuncture will help.
So how does this part help people going through the chemo treatment?
Chemo treatment. Okay, basically acupuncture and oriental medicine cupping is make yourself feeling better. So make you feeling stronger. So the cupping is a big portion of your body, your back muscle, right? And then we open up the muscle, blood circulation, which is energy circulation. So you moving more energy circulation.
Got it. It's been working.
Do you want? Yeah, click. Click, it's not here.
After treatment number 2, I have a relaxer in with the cold cap, and it really does work because this is probably what my head would look like without the cap. So, and there's a little spot over here too. But this is what we're dealing with. Like, and a lot of doctors and places don't believe in it, and it's scary. Like when you see that, 'cause that would be my whole head, and I'm trying to make this sort of still maintain some sense of normalcy and healthiness.
These are my scariest moments, believe it or not, which is, I feel weird taping them all. But I want to get the most vulnerable stuff, or not the most real, I think, in terms of sharing this process. This, for me, is hard. This is where I've had the most shedding and the most loss. This is sort of what I'm losing, which is less than what I normally do. Big chunk. Cartilage.
My follicles, right?
Yeah.
Get cold.
Freezes the follicle.
And freeze the follicle from the medicine getting to it, which then keeps my hair on my head.
And it's working.
And it's working. This is treatment number 3.
3 of how many?
4. And you have to shape
It would have been gone after the first.
It would have been gone day 18 after the first treatment. This fatigue is no joke. So this is I had treatment number 3 on Friday. This is Monday. And I, a little more fatigue and a teeny more nausea than normal. But I'm trying to push through it.
I'm 3 days before my 4th treatment, and just over these past couple days, I've been a little surprised by like some tenderness that I've been having within my body, my joints. Some of the stretches I typically do, I couldn't do. It just is very, very, very tender. Whenever I do share this, that exercise piece is key. I couldn't weight train this week, but I chose the yoga and the stretching, which I think has helped. But it was painful, ironically. Because when you physically don't feel well, your strength of mind starts to kind of get away from you, and you don't feel like fighting it, and you don't feel like talking it into something else. It's easier just to let it wander. Yeah, I'm a little unbalanced, so I'm gonna go and do meditation and then lay down and read tonight, and then we'll see how I do after that.
Okay. Documenting.
Oh, your label, baby. Yeah.
All right, this is officially my last cold cap.
You look close enough. I have some eyebrows that are still hanging on, but this is sort of, I think, sliding into home base, and I wanted to just document it and kind of showcase the fact that I have had some success with it. So I just had to take a mindful minute, to be grateful, to be unbelievably surprised, and to be hopeful. Everyone who had a phone conversation with me, who spent time with me, who traveled to see me, who took time out of their day to ask how I was doing, or even just check in, or even just thought about me when I didn't even know it. I thank every person, and the medical staff that I dealt with and I used to see every Friday, who I will see on Monday. I can't be more thankful for. Even though I love Peter.
Yeah. I don't never want to do this again.
Is this the last one?
Yeah.
Yeah. So,
Momentous occasion.
Yeah.
But you've done an amazing job.
So the cold cap was the key component to all of this entire ability for me to cope and for me to manage through the chemotherapy. I know I would have had a different journey had it not been for the ability to save the hair on my head.
Okay, morning. It is September 20th, my dad's birthday, and I just had a procedure on Monday called the nipple delay, which is to sort of help save your nipple area and stuff for the reconstruction surgery. And one area is a little larger than the other. So I'm not gonna, this left side is quite swollen. And it's very, very, very big. So like I can't even put my hand around it like I can on this one. So headed to the doctor to see what's up. And get it taken care of, hopefully. Okay, a little update from my message this morning, because we had to kind of do some drain work on that swollen left breast. And so as a result, we are kind of now dealing with this compression that I have to have for the next couple hours, just to make sure that that blood vessel is getting closed up. Just to showcase, I still have the compression on. I've had this since yesterday, and it just kind of kept everything tight. All the skin and the incisions compressed. I feel much better today. I feel 100 times different than I did yesterday. There's some pain, but I even had time to get out a little bit today. I went into the office for a quick meeting. So tomorrow is the next step in this first phase of the reconstruction procedure. I will get my pathology back tomorrow, because what they did is they took tissue from behind the nipple and areola area to make sure that tissue comes back clean with nothing in it to make it worth saving. And then they'll build the reconstruction around that. It's a lot scarier than I thought. It's uncomfortably scary. It's uncomfortably unknown. And this morning for a bit, I'm going to experience a little grief and loss. And I am preparing to head into surgery at 10:30 today. The surgery I'm getting today is officially called a double mastectomy. I refer to it as reconstruction. Part of me feels like I'm saying goodbye to a piece of myself. I'm losing a part of myself. It reminded me of what I once was told about how my soul is not my body. I would never have really elected to have a surgery of this magnitude if it wasn't preventative to save my life.
We're on our way to the surgical center.
Okay.
I'm supposed to not be videoing and driving.
No shit.
Right. To check in. Here's the vibe over here. What's going on?
Okay, so here I am in my surgical suite. I'm waiting to have all of the procedures begin, my pre-meds, the anesthesia and everything. Okay, here we go.
But there's also a piece of it that I've had to say goodbye to. I'm okay with that. I've accepted it, but it's hard sometimes.
So we'll end one more time. Dear God, smile when I say this. I am willing today to be the person you would have me be. I release to you all my illusions. Please strengthen me where I am weak and heal me where I am wounded. Here I am post-surgery, and I have to say I feel better than when I went in terms of my headspace. I'm extremely grateful in the fact that I came out of it and the guy upstairs, look at my swollen hands, took care of things. Well done. Now I'm just really trying to manage this pain. It's like a overwhelming soreness to my chest. Fear is the antithesis of faith. So I'm going to practice faith again because we have to get the pathology report back on my nodes and on my breast tissue. And unfortunately, we had one node that was inflamed, I guess, from what I heard. So I'm not sure I'm ready for another piece of this to manage. It's the day after. Ooh. I'm learning that out of the medication I'm taking, the Valium is like the best because of the muscle spasms. So that really is helping with me breathing, because I was trying to do my breathing exercises yesterday and I kind of couldn't because it's like very, very tight. But Dr. Chopra came by earlier today and liked everything he saw.
Working with these breast reconstruction patients has really sort of changed my practice and the way I look at things, and it makes me happier. And these patients really need your help. Not that other patients don't, but these patients didn't ask for this. They didn't choose to have it. They aren't choosing to have their breast augmented. This is just true reconstruction, just to make them feel whole again. And by doing that, it makes me feel like I'm helping and giving back. The most important thing is to get them cancer-free or reduce their risk as much as we possibly can. That's the most important thing. And I need them to grasp that. Once they can do that, then we can sort of get into the expectations of what to expect aesthetically.
I was able to be filled up with my expanders about 270 cc's per side, which was great, and I'm very grateful for Dr. Chopra for giving me a little bit of that because it does give me some elevation and I'm not completely flat. On pain management standpoint, I've been mostly now dealing with Tylenol and a Valium because the Valium helps the tenseness that happens up in the chest area. So typically I can just wear a shirt, a button-down shirt like this that covers kind of everything with the drains and with the clear dressing. But for right now, this will be the left side. There's a little bit of bruising, and that was from the hematoma I experienced. I was known as the hematoma patient when I went in to have the mastectomy. But basically you can see sort of how much I've been left with in terms of the amount of spacers and cc's that was put in, and then some of the bruising that's left over on that side. And then so here's a side view of the steri strip, the spacer, and then a little bit under the arm where the drains are coming from. So you get two drains technically from each side, and they come from, it's hard to see it, but they come from the armpit area. I can't lift my arms very much. And within those drains are liquid that needs to be emptied either AM or PM. And it's supposed to kind of help all the healing. I'm not actually sure what the fluid's for. I think it's a mix of blood and fluid and things like that.
today was a good day. Today was a day I prayed for really, really fervently, very, very, very strongly.
Good news!
Okay, let's keep going.
Hi. 6 negative notes. 6 negative notes.
One of the key things which I didn't speak about is that they have to let go of the process and let me take care of them. A lot of people are type A and they want to know every single thing that's going on. And at a certain point, they have to be like, all right, I trust you, you do your thing, and I'll do me. And it's hard to get those patients to get to that level, but once they said, okay, I'm going to trust the process, you're in charge, Christy's in charge, let's do it.
I am pleasantly surprised, grateful for my doctors, and grateful for my body for treating me so well and being my buddy.
Taking a walk I used to take over the past year when I wasn't feeling too hot because I was recovering from a breast cancer diagnosis I received to the day a year ago. And I felt it was something to do because just to kind of mark the occasion, not to mention, ironically, the day today is just as sunny and bright as it was back a year ago.
How to live now. What do you do moving forward? How do you take care of yourself? How do you remove the constant thought of something coming back? How do you relate to everyone else around you?
Once the whole battle mentality is over, the chemo's done, the surgery's done, and we're like a year plus out and it's just calm waters, they're not calm inside.
It has been a complete transformation of my mind, my body, and my spirit, internally and externally to those around me. I'm different, and I'm trying to make peace with the difference in me.
Do I worry the cancer could come back? Yeah. But I have a mindset now that's strong enough to cope with that and deal with it.
Getting back to living again is something I got to try and figure out how to do and make peace with. What I put in my body, I have to make peace with. I'm not sure. I'm studying stuff about that. And to continue honoring the stuff I've learned. I don't want to throw and get complacent and take everything that I've learned and toss it down the drain because now I'm healthy and I'm moving on and every day is just normal. It's not.
So here we are. Grateful, a little scared, happy, and extremely, extremely blessed to be able to put it behind me.
Thank you.
Say hi.